Welcome back, everyone. We're checking in with our good friend Dr. Teresa Baker from the Infant Risk Center. She's got a lot of information to get through. So let's get started about a couple of misconceptions and myths when it comes to early motherhood and breast pumps. What's the truth?
So the truth is, you know, we live in a day and age where most moms work.
Yeah.
And if you're going to go back to work at 6 weeks or whatever, you're going to have to pump. And we know the benefits of breastfeeding for both the mom and the baby.
Yeah.
So if we're going to ask them to go back to work that soon, they're going to have to incorporate pumping into their routine.
Right.
It's so tragic to me that we don't support breastfeeding moms more, but at least there's good options and more advanced options now. There's very efficient pumps. There's even pumps that you can wear while you work. And it just pumps the breast milk and staves it for the baby. There's really a lot of much more, and insurances pay for breast pumps now for moms. So there really should be no barrier that would keep you from having a very good breast pump.
Because we know the research is there, that it benefits, the benefits are incredible. And it just because most of the time our leave, especially here in the United States, is typically short. Other countries have longer ways, but we've got to have those. So there's a lot of controversy around pacifiers. So I know this gets into some heated debate. What do parents need to know about them?
Well, I think the most important thing is when they first get here, you just have to feed them on demand.
Yeah.
They're brand new, and so if they're hungry, let them eat. And then once they get, 2 to 4 weeks down the road, if you want to introduce a pacifier to give the mom a little break, all the research says it's not going to derail breastfeeding, and it may actually even prevent SIDS because the baby learns to self-soothe and it protects their airway to some degree. So it's certainly not a bad thing, and it allows the mom a little sanity.
But you said that's not until what, after the second?
Yeah, usually in those first few weeks, we want the mom to respond to feeding cues with letting the baby nurse until they establish a rhythm, because those newborns are so fragile and feeding them is so important. We want them to respond with breast milk.
Before we go, let's talk about the special offer and the great resources that you have for our viewers today.
So this is Breastfeeding Awareness Month, and so we have the Infant Risk has apps that are available, and there's 2 apps. One's directed to moms. It's called Mommy Meds, and the other is the healthcare professional app. We get about half of our calls come from healthcare professionals, half from moms. There's 20,000 drugs in the registry and information available. If you get on, and a healthcare provider can download from August 1st through the 7th for free and get a 3-month trial and just see if it helps you. This is a very unique knowledge base, and if we can support moms and babies and healthcare providers that are working with them, we want to do that.
It is such a remarkable resource. We are incredibly lucky to have it. Where can we go for more information?
InfantRisk.com, and we'd love to help anybody that has any questions, and if we can be of support, we want to be.
All right, Dr. Baker, thank you. We still have more Studio 4 to get to. Keep it here.